I know many of you are closely following the healthcare debate here in Washington. I'd like to take just a few moments to update you on the status of the discussions. We are on the verge of securing badly needed changes to dramatically improve our healthcare system. That is in large part due to your work and your leadership. Make no mistake, the need for healthcare reform is clear. The time to act is now. Health costs are crushing our workers, our families, and even the government. Premiums are rising 3 times faster than wages. That is simply unsustainable. The trustees of Medicare tell us that it will go broke in just 8 years. That cannot be allowed to happen. We simply can't afford the status quo. We can do better. And the proposal put forth by Finance Committee Chairman Max Baucus is a good beginning for how we can make significant changes. I believe the Baucus plan takes a reasonable, thoughtful approach to achieving the changes that we seek. But it's just a beginning. And just as important, the proposal was crafted in a way that is designed to win the 60 votes we need in the Senate to pass real reform. The Baucus proposal would end once and for all the shameful practice of denying health care coverage because of pre-existing conditions. It takes important steps to protect everyday North Dakotans by preventing insurers from raising premiums or dropping coverage in the event of sickness. It also does away with the often unfair caps on coverage that place an undue burden on workers and families facing serious illness. Finally, the Baucus plan is fiscally responsible. It improves health insurance so those who already have it won't have it taken away just at the time they become ill. It reforms the healthcare delivery system to control costs and improve quality. And it provides assistance to help workers and families afford health insurance. The Baucus proposal is completely paid for. It actually reduces the deficit, according to the Congressional Budget Office, by $49 billion over the next 10 years and by $1.3 trillion in the following decade. And most important, the Congressional Budget Office says it will slow the growth in health care costs that threaten to bankrupt us by implementing critical delivery system reforms. Not only will these reforms help bend the long-term cost curve in healthcare spending, but they will bring much-needed improvements in Medicare reimbursement to North Dakota's healthcare providers, our hospitals, our clinics, our doctors. Such improvements will strengthen our state's healthcare system and result in better healthcare outcomes for our friends, for our neighbors, and even for ourselves. But I also want to speak to a feature that is not in the Baucus plan, the so-called public option. I know that many of you feel strongly about it. It is important to know that plans put forth in both the House of Representatives and the Senate tie the public option to current Medicare reimbursement rates. This is a key detail that has a big effect in our state. As many of you know, North Dakota's Medicare reimbursement rate is the second lowest in the country. Administrators from hospitals all across North Dakota have told me that such a plan would essentially bankrupt every hospital in our state. It's not a defect of the public option, it is the fact that some of our colleagues have chosen to tie public option to Medicare levels of reimbursement. I said months ago, and I say again here today, I will not support a plan that would put our hospitals and our healthcare facilities on life support. That would be untenable for our state. Instead, I'm supporting an alternative plan, something I call the public interest option. It would provide not-for-profit insurance competitors to the current for-profit insurance companies that dominate the industry today. This model has competed and succeeded in many countries around the world. The increased competition helps to lower cost expand coverage, and results in actually better health care outcomes. That is the record, and that's the real goal with health care reform. We must always remember that our families, our friends, and our neighbors are paying the toll for our out-of-control system. Take, for example, the story of Sarah, a mother of two from Grand Forks. Sarah works hard and earns a decent wage. Still, the costs for regular checkups and antibiotic prescriptions for her children have forced her to choose between making her monthly mortgage payment or ensuring that her kids get the care that they need and that they deserve. And then there's the story of Margot and Teddy. I recently received a letter from this Fargo couple that I want to share with you. Margot writes, and let me read from the letter. I'm 51 years old. I've never given much thought to writing a senator until now. 3 days ago, we received some of the worst news a person can get. My husband was diagnosed with bladder cancer. He does not have health insurance. We are self-employed. Our income is low, but we do own some property which makes us ineligible for most assistance programs. A few years ago, we both dropped our Blue Cross Blue Shield coverage because the premiums were too high for us. I reapplied and got my insurance back, but my husband was denied due to his weight. He quit smoking 4 years ago and put on weight gradually since then. We were stunned by the diagnosis and terrified by the uncertainties of the prognosis. We already owe $2,000 just for emergency room costs, and he has surgery scheduled for September 22nd, with at least an overnight stay in the hospital. The medical bills will be astronomical. If the cancer is not localized, he will be referred to oncology and will begin chemotherapy treatments and possibly even more surgery. We will have to sell almost everything we own to pay the bills. Please, sir, consider our story when thinking about healthcare reform. Any changes will happen too slowly to help us, but others will benefit. Don't give up. We're counting on you to make a difference. These stories, like the stories from hundreds of other North Dakotans, are both tragic and unnecessary. I promised Sarah and Margot and Teddy, and I promise you today that I will not give up. I will continue to fight for reform that reins in skyrocketing healthcare costs, that holds insurance companies accountable, that expands coverage, and that improves quality for North Dakotans. For the sake of our children and our grandchildren, we can and we must do better. Making quality healthcare affordable and accessible in every North Dakota community is among my top priorities in the Congress. I look forward to working with you as we continue to fight for comprehensive healthcare reform that works for North Dakota's workers and that can actually get passed into law.